Imagine watching someone collapse after a blow to the head. It's a terrifying moment, but what happens next can be even more shocking. Their body suddenly assumes a strange, rigid posture, one arm outstretched, the other bent at the elbow. It's an eerie sight, almost as if they were posing for a fencing match. This response, known as the fencing response, is a rare but serious sign of traumatic brain injury, TBI. But that's not all. Sometimes, the situation worsens as the person begins to seize, their body convulsing uncontrollably. These moments are more than just symptoms, they are signals of a potentially life-threatening injury. What is the fencing response? The fencing response is an involuntary postural reaction that can occur immediately after a traumatic brain injury. It's named because it mimics the stance of a fencer, one arm outstretched, the other flexed. This peculiar response lasts only a few seconds, but those seconds can feel like an eternity, especially if you're witnessing it. What makes the fencing response so alarming is that it often signals a severe TBI, particularly in cases where the person loses consciousness. Now, not everyone who suffers a TBI will exhibit the fencing response. It's a rare occurrence, but when it does happen, it's crucial to recognize it for what it is, a sign that immediate medical attention is needed. This response can be triggered by various types of head trauma, including sports injuries, car accidents, and falls. The connection between fencing response and seizures. Seizures are another potential consequence of TBI, caused by abnormal electrical activity in the brain. They can vary widely in how they present, from subtle changes in consciousness to full-blown convulsions. The link between the fencing response and seizures isn't fully understood, but there is evidence to suggest that they can occur together. A 2022 study reviewed videos of individuals who had suffered TBIs and found that the fencing response was present in nearly half of the cases. Seizures were also common, occurring in about 44% of the cases studied. Intriguingly, in some instances, both the fencing response and seizures occurred simultaneously, highlighting the severity of the brain injury. While these findings are significant, it's important to note that the study was based on a small sample size. However, the takeaway is clear: both the fencing response and seizures are serious indicators of brain injury, and when they occur together, the situation is particularly dire. Other types of posturing after a TBI. The fencing response isn't the only postural change that can follow a TBI. There are two other types of abnormal posturing associated with severe brain damage: decorticate and decerebrate posturing. Unlike the fencing response, which happens immediately after the injury, these postures can develop days or even weeks later as a result of swelling or other complications. Decorticate posturing involves the arms bending inward toward the chest, clenched fists, and legs that are fully extended and rotated inward. It's a sign that there is damage to the brain's pathways above the level of the brain stem. Decerebrate posturing is even more severe, with the arms straightened and rotated inward, legs extended, and toes pointed downward. This posture indicates damage to the brain stem itself, a critical area that controls many of the body's automatic functions. Both types of posturing are signs of severe brain injury and require immediate medical intervention. The key difference between these postures and the fencing response is timing. The fencing response happens immediately, while decorticate and decerebrate posturing develop later. Other symptoms and complications of TBI. Beyond the fencing response and seizures, TBIs can cause a wide range of symptoms. Some are immediate, while others may persist long after the initial injury. These can include headaches that range from mild to debilitating, dizziness or balance problems that make it difficult to walk or stand, memory and cognitive issues that affect the ability to think clearly or remember details, mood changes such as irritability, anxiety, or depression, sleep disturbances that make it hard to fall asleep or stay asleep, behavioral changes that alter how a person interacts with others. Other signs to watch for include convulsions, blurred vision, clear fluid draining from the nose or ears, and a loss of consciousness. Any of these symptoms following a head injury should be treated as an emergency. The importance of immediate medical attention. The seriousness of a TBI cannot be overstated. When someone exhibits signs like the fencing response, seizures, or any of the other symptoms mentioned, immediate medical attention is crucial. The faster a person receives treatment, the better their chances of recovery and reducing the risk of long-term complications. According to the Centers for Disease Control and Prevention, CDC, individuals with moderate to severe TBIs may need specialist care during their recovery. This can include rehabilitation therapy to help them regain lost skills, such as memory retention, driving, or even returning to work. Recovery times vary widely depending on the severity of the injury and other factors like overall health and access to quality health care. Conclusion: recognizing the red flags. The fencing response and seizures are rare but serious signs of traumatic brain injury. They serve as red flags that the brain has been severely injured and requires immediate attention. By understanding these signs and knowing what to look for, you can act quickly to get help for yourself or someone else, potentially saving a life. In the aftermath of a TBI, recognizing the symptoms and getting prompt medical care are the first steps toward recovery. While the road to healing can be long and challenging, early intervention makes all the difference. If you or someone you know experiences any of these symptoms following a head injury, don't hesitate, seek medical attention right away. Your brain is too important to take chances with.